Hi, this is Jerry Hesch from the Hesch Institute in Aurora, Colorado. And I have a home office, and I have a client who flew from Honduras to come see me in Aurora, Colorado. And so I'll ask him a couple of questions. This is the end of his third visit, and we typically see patients for 3 days in a row, and our visits are up to 2 hours each. And I'll start by asking him, why did you come to Aurora, Colorado?
Well, I felt discomfort in my pelvis, especially when I was sitting or standing for prolonged periods. I had visited many healthcare providers, orthopedists, and physical therapists, and I didn't feel I get the improvement. I always continued feeling the discomfort. So I started, once I searched on the internet and I saw options, and I saw Dr. Hesch video, and it caught my interest. I started investigating more of who he was and his background. So I decided to give myself a chance and visit his office.
Very good. And what was your problem? When did your problem start, and how would you describe it?
It is hard for me to relate an incident, but I believe it was helping with the unloading of a heavy furniture on December, 4 months ago.
Mm-hmm.
And I started feeling pain when I was sitting. When I stood up after a long period sitting, and when I stood, when I was standing, in one side of my lower back. I went to, as I said, to doctors. They are competent and good physicians, but they didn't have the level of knowledge that Dr. Hesch has in this particular type of injury.
So you feel like the hands-on evaluation was important?
Yes, definitely. In the first day, you identified exactly what was the part that wasn't working correctly. And
do you know the name of that?
yes, it's the SI joint.
The sacroiliac joint?
Yes.
It's called a posterior ilium fixation. So the right ilium could move backwards, but it could not move forward. And that's a simplistic definition, but we'll go with that one. And you felt like something was stuck.
Yes, intuitively I felt that it was mechanical, that it wasn't an illness, that it was something that was stuck in my bones, or skeleton.
Sure.
Skeleton, but
Yeah.
and the muscles, but for some reason the other professionals did not identify that particular situation that I had.
So it was the passive testing in which I was able to discern the way that it moved, but also the way that it didn't move normally.
Yes.
And how did we treat it?
Well, it was a very simple, apparently simple maneuver that you did. It was gentle, and it took less than 5 minutes. And in that very moment, I didn't feel the release, but it was in the rest of the day that I started testing myself, walking, sitting, and the pain was gone.
And it's been 4 days now since the first treatment.
Yes, 4 days, and I still feel the same relief.
And how are you better? How do you know that you're better?
Well, because I sat for 2 hours with no pain. And when I came here, I couldn't sit for 15 minutes without starting to feel some kind of discomfort that would grow with time.
Yes. And did we teach you how to treat it yourself?
Yes, that's something else. From the beginning, you explained that you wanted me to be independent, that you would make the first correction, but then I had to be treating myself without being completely independent. That is something that's important for me.
So how many days did I treat you actually with hands-on?
one day, the first day.
Yes.
And then the rest of the visits have been for verifying that the correction is still there, and review other parts that would help me.
Yeah, we did end up treating stuck subtalar joint, the joint that is below the ankle. And we were able to restore normal movement there.
Yes.
And we did measure you for custom orthotics. And we taught you how to keep that motion in the foot and ankle. And we were going to treat your upper neck because you had what we call a compensatory rotation up high. But after we treated the foot and ankle and treated your pelvis, the neck went, it self-released, it reflexively released. So we don't always treat everything we see, but we do a whole body approach and make sure that everything is taken care of. So was this the first time you had someone look at your whole body?
Yes, definitely. The typical experience when you visit an office is that they focus on the point where you are aching, the point of your body where you are aching, and they do not review the rest of the unit. Because that's what it is. The body is a unit.
Absolutely.
And every part is affected.
Yeah.
So that was very positive.
Yes. So you're glad you came from Honduras?
Yes, of course. Imagine, after 4 months, and I finally found a release.
Yes. Very good.
Yes.
Well, thank you for taking the track. That's,
Thank you. Thank you. Thanks to you, doctor.
Glad you're better.